If you are a man over 50, you have likely heard two completely contradictory pieces of advice regarding your sexual health. On one side, you have the medical studies telling you that frequent ejaculation is the golden ticket to preventing prostate cancer. They tell you to use it or lose it. But then, there is a darker side to that story, one that isn't discussed as openly in medical journals, but is flooding urology clinics everywhere. It's the reality written right on the thumbnail of this video: the loss of sensation, the dreaded numbness. So, here's the dilemma. You want to protect your prostate. You want to keep your system running, but you notice that daily gratification seems to be yielding diminishing returns. Maybe it takes longer to reach the finish line. Maybe the sensitivity just isn't there anymore. And suddenly, you're asking yourself, is my daily habit actually destroying my ability to function with a real partner? Today, we are going to look at the hard science and the clinical reality often discussed by top experts in the field, like Dr. Laura and other leading urologists, regarding what actually happens to the male body after half a century of wear and tear. We aren't just talking about the prostate. We are talking about the nerves, the brain, and the hormones. By the end of this video, you're going to know exactly where the line is drawn between a healthy routine and a damaging compulsion. You will know the exact frequency sweet spot for men over 50. Let's get into it. To understand whether daily masturbation is a health hack or a health hazard, we first have to accept a biological reality. The machinery has changed. When you were 20, your body was flooded with peak levels of testosterone, your vascular system was highly elastic, and your recovery time, medically known as the refractory period, was practically non-existent. You could engage in daily activity, sometimes multiple times a day, and your body would bounce back almost instantly. However, once you cross the age of 50, the internal landscape shifts. The first major change is hormonal. While it is true that testosterone levels decline gradually, about 1% a year after age 30, what matters more is the ratio of free testosterone to estrogen and other binding proteins. As this balance shifts, your libido might remain mental, but the physical response doesn't always align with the desire. You might want to engage daily, but your body is working twice as hard to achieve the same result. Then, there is the issue of vascular health. Erections are fundamentally a blood pressure event. Over time, blood vessels naturally lose some of their elasticity, and plaque can begin to build up. When you force a daily erection on a system that already has slightly restricted blood flow, you are putting stress on the tissues. The sponge-like tissue in the penis requires oxygenated blood to stay healthy, but it also requires rest to recover from the high-pressure state of an erection. Perhaps the most critical factor to understand here is the refractory period. In your 50s and 60s, the time required between ejaculations increases significantly. This isn't a dysfunction, it's a safety mechanism. When you try to override this natural recovery phase by forcing a daily routine, you aren't just cleaning the pipes. You are potentially fatiguing the neurotransmitters and the smooth muscle tissue that controls erectile function. So, physically speaking, daily for a 50-year-old is a much heavier biological workload than it is for a younger man. And this physical strain is exactly what opens the door to the desensitization we need to discuss next. Let's address the elephant in the room. The text on the thumbnail makes your penis numb. Is this fear-mongering, or is it a medical reality? For many men over 50 who masturbate daily, this is becoming a clinically distinct condition. In urology circles and sexual health forums, this is often colloquially referred to as death grip syndrome, and it is not a myth. The problem stems from a basic issue of physics and conditioning. Your hand is capable of applying significantly more pressure, friction, and speed than any partner's body ever could. When you repeat this specific, high-pressure motion daily, often out of habit or a need to force an erection that isn't quite ready, two things happen. First, there is the dermatological and nerve-level effect. The glans is a mucous membrane designed to be highly sensitive. However, the body is adaptive. If you subject that tissue to aggressive, dry, or high-friction handling every single day, the skin can undergo a process called keratinization. Essentially, the skin toughens up to protect itself, similar to how a callus forms on a guitarist's fingertips. You begin to lose fine touch sensitivity. Deeper than the skin, you are desensitizing the dorsal nerves. These nerves are designed to respond to warmth, moisture, and subtle friction, not crushing pressure. If you blast them with high intensity every 24 hours, they raise their threshold for activation. But the numbness isn't just in the penis, it is also in the brain. This is the concept of the superstimulus. If your daily routine involves not just the physical sensation of a tight grip, but also the visual hyperstimulation of digital pornography, you are creating a perfect storm for desensitization. You are training your nervous system to associate arousal only with that specific combination of extreme visual input and extreme physical pressure. This is where the situation becomes tragic for many men over 50 who are trying to maintain a sex life. You might be able to achieve an erection and orgasm by yourself just fine. But when you are with a real partner, you might find yourself unable to finish or even losing your erection mid-act. This is often misdiagnosed as standard erectile dysfunction, but pills won't fix it because the plumbing works fine. The issue is that the sensation of a real partner feels numb by comparison to your hand. It feels like there is no friction. You haven't lost your nerve endings, but you have conditioned them to require a level of stimulation that reality simply cannot provide. So, yes, the thumbnail is correct. Daily masturbation can make you effectively numb, but it is driven by the intensity and the technique you are using to chase that daily high. Now, we have to look at the other side of the argument. If daily masturbation can cause desensitization and potential nerve fatigue, why do so many urologists seemingly recommend it? The answer usually leads back to one piece of data that made headlines around the world: the Harvard University study published in European Urology. This study followed over 30,000 men for nearly 2 decades, and the results were striking. The data showed that men who ejaculated 21 times or more per month had a roughly 31% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times a month. This is where the use it or lose it mantra comes from. The medical theory behind this is known as the prostate stagnation hypothesis. Think of the prostate as a biological filter and a storage tank. It produces a significant portion of the fluid that makes up your semen, which is rich in zinc, citric acid, and enzymes. The theory suggests that if this fluid sits in the prostate for too long without being flushed out, it can become stagnant. Over time, chemical carcinogens found in the blood or urine could potentially accumulate in the prostatic ducts, leading to cellular damage and, eventually, cancer. By ejaculating frequently, you are essentially flushing the system, clearing out old fluid and potential toxins. However, there is a massive nuance here that often gets lost in the headlines. The study highlighted 21 times a month as the upper tier for benefits. That averages out to about 5 times a week. It does not necessarily prove that daily masturbation, meaning 30 or 31 times a month, offers any additional protection. In medicine, we look for the point of diminishing returns. If you are forcing yourself to ejaculate every single day solely for cancer prevention, but you are suffering from the numbness we discussed earlier, you have likely crossed the line of benefit. Furthermore, we need to make a critical distinction between prostate cancer and BPH, or benign prostatic hyperplasia. BPH is the enlargement of the prostate that causes you to wake up 3 times a night to urinate, a condition most men over 50 are all too familiar with. Many men mistakenly believe that draining the prostate daily will shrink an enlarged prostate. The science does not support this. While ejaculation is healthy for the cells, it does not mechanically reduce the size of the gland. In fact, for some men suffering from prostatitis, which is inflammation of the prostate, aggressive daily ejaculation can actually increase irritation and pelvic pain rather than relieve it. So, while the cancer prevention data is real, it should not be treated as a mandate for daily compulsion. The goal is consistent circulation and clearance, not mechanical exhaustion. The prostate benefits from regular activity, but it does not require you to grind your nervous system down to get there. And speaking of the nervous system, we now have to talk about the brain, because this is where the daily habit takes its biggest toll. We have covered the plumbing and the nerves, but we have ignored the most important sexual organ you possess, the brain. This is where the daily habit of masturbation after 50 often shifts from a physical release to a chemical dependency. There is a misconception that porn-induced erectile dysfunction is strictly a problem for young men in their 20s who grew up with iPads. However, leading behavioral health experts and urologists are seeing a massive spike in this issue among men in their 50s and 60s. To understand why, you have to look at dopamine. Dopamine is not just the pleasure molecule, it is the molecule of motivation and craving. Every time you orgasm, your brain releases a flood of neurochemicals, dopamine, oxytocin, and endorphins. It is a powerful cocktail. When you engage in this daily, especially if you are pairing it with high-speed internet pornography, you are flooding your reward system with cheap dopamine. Here is the trap for the man over 50. As your natural testosterone levels decline, your baseline drive for pursuit, the energy required to woo a partner, engage in foreplay, and perform physically, naturally dips. If you train your brain that it can get a massive, instant dopamine reward with zero effort, zero rejection risk, and zero emotional vulnerability just by clicking a mouse and using your hand, your brain will take the path of least resistance every single time. This brings us to a biological phenomenon known as the Coolidge effect. This is the instinctual drive for novelty. In a natural setting, novelty is hard to find. But online, novelty is infinite. You can click through 100 different scenes in 10 minutes. This hyperstimulation fries your reward circuitry. You are spiking your dopamine so high that normal life starts to feel flat. This is often called the flat line. When you turn to your wife or partner after months or years of this daily high-speed conditioning, a real human body can't compete. A real partner doesn't change into 3 different people in 5 minutes. A real partner requires patience. Because your brain has been conditioned to expect the hyperspeed and hypernovelty of the screen, it fails to send the erection signal when faced with the slower pace of reality. You might love your partner, but your brain is bored because it's used to a much higher drug. This is where the daily habit becomes dangerous, not for your prostate, but for your relationships. Many men over 50 claim they masturbate daily for stress relief. And while orgasm is a great stress reliever, there is a fine line between release and numbing out. If you find that you are masturbating daily not because you are undeniably horny, but because you are bored, anxious, lonely, or avoiding intimacy with your partner, the habit has become a compulsion. You are using the dopamine hit to medicate your mood. And the price you pay for that medication is your ability to connect sexually with a real person. You are essentially siphoning off your sexual energy into a void, leaving nothing in the tank for the relationship that actually matters. When we synthesize the advice from leading figures in urology and sexual health experts who treat thousands of men over 50, a very specific and somewhat alarming pattern emerges in the examination room. These doctors often describe a patient who comes in convinced he has a medical catastrophe. He is certain his testosterone has crashed or that he has developed severe vascular disease because he can no longer perform with his wife. He demands a prescription for the strongest blue pill available. But when the doctor runs the blood work and checks the vitals, the testosterone levels are often perfectly normal for his age, and the blood flow is adequate. The problem isn't hormonal failure, it is behavioral exhaustion. The consensus among these specialists is that men are often their own worst enemies when it comes to the use it or lose it principle. To be clear, the experts confirm that use it or lose it is medically valid. Penile atrophy is a real condition. If a man stops having erections entirely for months or years, the collagen in the penile tissue creates fibrosis. Without the regular influx of oxygenated blood that comes with an erection, the tissue loses elasticity and can actually shrink in length and girth. However, urologists draw a hard, distinct line between maintenance and abuse. They emphasize that preventing atrophy does not require a daily, high-friction climax. Your body actually has a built-in maintenance system called nocturnal tumescence, those erections you get while you sleep. If you are healthy, your body does the using for you at night. You don't need to manually force an ejaculation every 24 hours to save your size. In fact, instead of prescribing more masturbation, many top experts are now pivoting the conversation to the pelvic floor. As men age, the muscles that support the bladder and bowel, and which are crucial for sustaining an erection, begin to weaken. Rather than advising a daily death grip session, Urologists often recommend that men over 50 focus on Kegel exercises. Strengthening the bulbocavernosus muscle provides a tangible improvement in erection hardness and control without the desensitizing side effects of excessive friction. The medical verdict is consistent. You want to keep the system active to prevent atrophy, but you must avoid the chronic overuse that leads to the clinical numbness we discussed earlier. It is about finding a rhythm that supports your biology rather than exhausting it. Now, before we get to the final verdict on frequency, we have to address the hardware issue we just touched on. We talked about how blood flow changes and how dangerous relying on pills can be. If you are looking to restore that rock-hard firmness naturally, without the nasty side effects of medication, you need to see something that is changing the game for thousands of men. There is a short presentation detailing a bizarrely simple 7-second morning ritual involving a unique purple tonic. It doesn't just mask the problem, it targets the biological root cause of limpness, a specific enzyme that kills erections, to help you get stiff and stay that way. I've put a QR code on the screen right now. Point your phone's camera at it to watch that video immediately. I've also pinned the link to the top of the comments section below. If you want to feel that youthful surge again, pause this video and go check that out. Now, let's get back to the final verdict. So, what is the final verdict? Does masturbating daily after 50 destroy your health, or does it save your life? The answer, as we have discovered, lies in the balance between mechanism and motivation. Based on the data regarding prostate cancer prevention and the risks of desensitization, the optimal frequency for the average man over 50 is not necessarily daily. For the vast majority, the sweet spot, the Goldilocks zone, appears to be roughly 2 to 4 times a week. This frequency is high enough to satisfy the 21 times a month metric suggested by the Harvard study for prostate flushing, but low enough to allow your nerves, hormones, and refractory period to recover fully between sessions. However, if you are watching this and realizing that you are already suffering from the numbness or the death grip symptoms we discussed, where your hand is the only thing that works, you need a different protocol. You don't need moderation, you need a reset. The most effective way to reverse desensitization is to take a hiatus. A period of 30 days without masturbation or digital pornography can allow the keratinized skin to soften and, more importantly, allow your dopamine receptors to reset. It won't be easy, but it is the only way to rewire your brain to appreciate the subtleties of a real partner again. Finally, remember that your prostate health is not solely determined by your ejaculation frequency. Diet, exercise, and lowering inflammation are far more critical factors than hitting a specific number on a scorecard. Don't treat your sexuality like a chore list. Keep the circulation moving, but treat your nervous system with respect. If you found this deep dive helpful and want to understand more about how to optimize your body as you age, make sure to subscribe and turn on notifications. We have a lot more to cover. Take care of yourself, and I'll see you in the next video.